In this podcast episode, Dr. Jonathan Haidt discusses the impact of smartphones on mental health, particularly in children and teenagers. He highlights the significant increase in anxiety, depression, and self-harm rates among young girls starting around 2012, which he refers to as the Great Rewiring of childhood. This period saw a sharp uptick in mental health issues, especially among girls, due to the widespread adoption of smartphones with social media platforms like Instagram. Dr. Haidt explains that the rise in mental health issues can be attributed to various factors related to smartphone use. These include the amount of time spent on social media, exposure to harmful content, disrupted sleep patterns, increased blue light exposure, and sedentary behavior. Girls, in particular, are spending an average of 5 hours a day on social media, leading to a total of 7 to 10 hours of screen time daily when considering other smartphone activities. To provide context, Dr. Haidt discusses the historical shift from a community-based lifestyle to a more individualistic and isolated one. In the 1950s and 60s, children played outdoors in close-knit neighborhoods where adults collectively supervised them. However, societal changes, such as the rise in crime rates and the erosion of trust among neighbors, led to a decline in community cohesion. This loss of community support and supervision contributed to the shift towards a more screen-based childhood. By the 1990s, concerns about child safety, including child abduction and sexual abuse, led to increased parental anxiety and a shift towards more supervised and indoor activities for children. This marked the beginning of the transition from a play-based childhood to a phone-based childhood. Parents became more cautious about letting their children play outside unsupervised, leading to a decrease in outdoor playtime and social interactions among children. Dr. Haidt emphasizes the detrimental effects of social media on mental health, especially for young girls. The constant exposure to curated and often unrealistic images on platforms like Instagram can contribute to feelings of inadequacy, comparison, and anxiety. Additionally, the addictive nature of short videos on platforms like TikTok and YouTube further exacerbates mental health issues by providing quick and frequent reinforcement. Despite the concerning trends in mental health, Dr. Haidt offers solutions to address the negative impact of smartphone use on children and teenagers. These solutions include setting limits on screen time, promoting outdoor play and physical activity, fostering face-to-face interactions, and creating a supportive community environment. By implementing these strategies, parents and caregivers can help mitigate the adverse effects of excessive smartphone use on mental health. The arrival of smartphones and tablets has ushered in a new era of childhood, where children are increasingly connected to the internet and social media. Boys are drawn to activities such as war games and violence, while girls are more interested in social media platforms like Instagram. The easy access to content, such as pornography, on these devices has raised concerns about the impact on sexual development in adolescents. The instant gratification and lack of effort required in accessing such content can lead to addiction and distorted views of relationships and sex. Haidt and the host delve into the effects of pornography on sexual development in adolescents. The ready availability of pornography on smartphones and the internet triggers significant dopamine releases, leading to addictive behaviors. The rapid rise in dopamine levels without the effort of courtship and pursuit in real-world relationships can distort the brain's reward system. This can result in issues such as erectile dysfunction, anxiety, and a disconnect between sexual experiences in real life and those portrayed in pornography. Haidt emphasizes the importance of courtship and learning in relationships for the development of healthy sexual behaviors. Real-world dating and relationships require effort, communication, and learning, which are lacking in the instant gratification provided by pornography. The observational nature of pornography can hinder the development of essential skills and understanding in sexual relationships, leading to difficulties in real-world interactions. Haidt discusses the differences in online behavior between boys and girls. He notes that girls tend to focus on perfectionism and image maintenance, spending more time curating their online presence. In contrast, boys engage in more clapback humor and show off their cleverness in online interactions. Boys' online interactions are characterized by quick wit and one-upmanship. Haidt highlights the concerning increase in suicide rates among both boys and girls. While boys have a higher suicide rate overall, girls are experiencing a larger increase in suicide rates. He explains that boys tend to use more violent means, such as guns or jumping from tall buildings, while girls often attempt suicide through pills or self-harm. Social media platforms play a significant role in shaping children's mental health and well-being. Haidt points out that the fear of missing out and the pressure to maintain a perfect online image contribute to anxiety and depression among young people. The performative nature of social media interactions can lead to misunderstandings, conflicts, and cyberbullying. Haidt discusses the importance of hierarchy and leadership in social dynamics, particularly among boys and men. He emphasizes the concept of dynamic subordination, where individuals take on leadership roles based on their skills and expertise. In healthy social groups, individuals trust and support each other, leading to effective collaboration and problem-solving. During puberty, the brain undergoes rapid changes, with the prefrontal cortex learning to suppress impulses driven by the hypothalamus. Hormones like testosterone and estrogen play a crucial role in organizing the brain, leading to behavioral changes and self-concept development. The thickening of vocal cords in boys and bodily changes in girls also contribute to identity formation during this period. Haidt explains that puberty is a critical developmental milestone, marking the fastest rate of aging and significant brain plasticity. Haidt discusses the concept of neuroplasticity, highlighting how the brain responds to rewards and punishments. He explains that dopamine, a key neuromodulator, accelerates learning and plasticity, particularly in response to rewarding experiences. The reinforcement of behaviors through dopamine release can lead to heightened plasticity in neural circuits, making it easier to repeat those behaviors in the future. This mechanism is crucial during puberty, when the brain is highly sensitive to rewards and experiences. The conversation delves into the negative effects of social media on adolescents, especially during puberty. Haidt emphasizes the dangers of exposing children to social media platforms at a young age, where they are rewarded for likes and followers based on performative behaviors. He warns against the potential consequences of early social media use, including exposure to harmful content, comparison with others, and the pressure to maintain a certain online image. The discussion underscores the need to protect children from the negative influences of social media during their formative years. Haidt proposes 4 key recommendations to mitigate the negative impact of technology on children, particularly during puberty. The first recommendation is to delay the introduction of smartphones until high school, advocating for simpler devices like flip phones for communication. By limiting access to smartphones, parents can protect their children from the constant exposure to the internet and social media at a young age. The second recommendation is to restrict social media use until the age of 16, recognizing the detrimental effects of early exposure to online platforms on adolescent development. By delaying access to social media, parents can shield their children from the pressures of seeking validation through likes and followers, promoting a healthier approach to social interactions and self-esteem. The third recommendation focuses on implementing phone-free policies in schools to create a conducive learning environment free from distractions. By establishing phone-free zones, schools can support students in focusing on their studies and social interactions without the interference of digital devices. The fourth recommendation emphasizes the importance of parental guidance and monitoring of children's online activities. By actively engaging with their children and setting boundaries on technology use, parents can help mitigate the negative effects of social media and technology on adolescent development. Haidt highlights the addictive nature of smartphones and social media, comparing them to slot machines that provide temporary pleasure but ultimately lead to negative consequences. He explains how the constant need for stimulation and the fear of missing out drive many young people to spend hours on their devices, leading to feelings of loneliness and anxiety. Haidt discusses the role of summer camps in providing a detox from technology and allowing children to experience real-world interactions and activities. He also highlights the benefits of team sports and religious participation in promoting social connections and mental well-being among young people. The guest explores the idea of wordlessness and the value of being in a state of quiet reflection and self-awareness. He suggests that allowing children to experience boredom and silence can help them develop a better understanding of their own preferences and emotions, leading to a more balanced relationship with technology. Haidt criticizes social media companies for exploiting children's attention and time for profit. He compares the influence of these companies to a casino, where children are constantly engaged in a behaviorist loop of seeking rewards. He highlights the addictive nature of social media, which is more behaviorally addictive than traditional forms of media like television. Despite the challenges posed by technology, Haidt remains optimistic about the potential for change. He rates his optimism at a 10 out of 10, citing the growing awareness and public disgust with the current state of children's engagement with technology. He believes that within 2 years, there will be significant shifts in societal norms around technology use, leading to a more balanced and fulfilling childhood experience for young people. To accelerate the process of change, Haidt encourages individuals to engage in collective action by discussing the issue with friends, family, and community members. He also suggests supporting organizations and initiatives that promote healthier technology use for children. By raising awareness, advocating for policy changes, and promoting alternative activities for children, individuals can contribute to creating a more positive environment for youth.